Across the country are devastated. In many instances, their healthcare costs are more than their mortgage costs or their rent, which, by the way, is a first in American history. This is particularly unfair to millennials and younger Americans generally, who will be totally crushed. Workers' hours are being cut, hiring is frozen, totally frozen, and wages are being slashed. If we don't repeal and replace Obamacare, we will destroy American healthcare forever.
आज हम सिकनेस को एड्रेस करते हैं, आवश्यकता है हम वेलनेस को एड्रेस करें। हम बीमारी की चिंता करते हैं, हम स्वास्थ्य की चिंता कम करते हैं, और इसलिए प्रिवेंटिव हेल्थ केयर, पैरामेडिकल फोर्सेस, ये सारी शक्तियों को कैसे जोड़ा जाए। भाइयों बहनों, हेल्थ इंश्योरेंस की बातें बहुत हुई है। 21वीं सदी में हमें गारंटी देनी होगी। हेल्थ इंश्योरेंस से अटकना नहीं है, हेल्थ एश्योरेंस का वादा करना होगा।
They know something is not right here. They are not getting that kind of confidence. They are not getting that kind of assurance that their business is going to lift. Ultimately, who are the beneficiaries of this mission? These are the general public at large. 68% of Indian populations who live in villages earn less than $1 per day. Healthcare is a bigger challenge.
Healthcare in India has assumed a more dynamic form over the last few years, offering exciting opportunities for new reforms and improving stagnant indicators, addressing concerns of access, affordability and quality across. India's cost efficiency and competency are the biggest advantages over other countries. India's cost of production is nearly 60% lower than that of the US and almost half of that of Europe. Labor cost is almost 50 to 55% lower than Western countries, and cost of setting up a plant too is lower by about 40%. The other benefit India has is skilled workforce and competent technical expertise in comparison to its peers. India has the second largest number of US FDA approved manufacturing plant outside the US and has 2,633 FDA approved drugs. Ladies and gentlemen, the $26 billion Indian pharmaceutical industry, aiming to be among the top 3 pharma markets by 2020, is expected to reach $55 billion in the next 4 years, growing at a pace of 17.90% CAGR. The market size has expanded to USD 36.7 billion in 2016 from USD 6 billion in 2005. India today is standing on the threshold of enormous opportunities where the global market is looking at us with much seriousness to invest and to do business than ever before. The domestic healthcare scenario though presents serious challenges as patients' safety and quality healthcare with affordable price has become a subject of tremendous concern. We as a nation must understand that healthcare is key to nation building. Like defense, healthcare sector must be given a topmost priority. Said Satya Brahma, Chairman and Editor-in-Chief of Pharma Leaders Group, while announcing the 9th annual edition of Pharmaceutical Leadership Summit and Pharma Leaders Business Leadership Awards 2016. Satya further says that patient-centered care has now made it to center stage in current discussions of quality and patient care. Pharmaceutical companies, government and healthcare practitioners therefore must ensure that patient-centric healthcare delivery system is key to growth, and there should be greater focus on patient satisfaction and engagement. Healthcare provider must focus on consumers in a way that encourages them to seek all care within the system, optimizing care management and patient engagement. While companies and hospitals are measured on their success through revenue and profit in recent times, the success also should be on compassionate healthcare, and initiatives must focus on medical facilities to reduce patient suffering and meet patient needs. Ladies and gentlemen, Pharma leaders feel that leadership, change and innovation are the hallmarks of Pharma leaders' preface to grow, and no matter where you are, what you do, when to do. If you innovate and embrace healthcare with change and disruption, you are sure to succeed and be the leader. Pharma leaders strongly feel that the rules of the game have changed. Opportunities are now beginning to be rewarded. The institution Pharma Leaders honors the principles and prominent leadership of the healthcare global leaders, decision makers, and various organizations that are path breakers of leadership excellence. It focuses on the remarkable achievements and noteworthy influence of these leaders, and also throws light on the pivotal role played by them in leading the healthcare transformation to the threshold of the new world. It aims to make a quantum leap and a comprehensive approach in the performance of all those who have contributed immensely to make the vision a great success, and who were able to take the maximum advantage of the opportunities available to them regionally and internationally, and making the best out of those opportunities. Pharma Leaders is an independent research-driven new age healthcare media group that aim to bring the ground report of prevailing healthcare situations and report issues that remain behind the carpet. We are independent, bold and fearless, and we don't get convinced. If asked to be, we convince the society to foster healthcare innovations, reforms, and patient-centric initiatives, because we feel it is always patient first. In India, public healthcare is free, yet years of underinvestment in public health means that facilities are also grossly understaffed and under-equipped. The country also has a massive resource gap of over 4 million health workers, and to compound problems, nearly 60% of existing health workers practice in urban areas. Ironically, with 70% of its people living in villages, often far from healthcare providers, it's clear that there's a lot of room for affordable health services to grow in India. In rural India, almost 80% of the out-of-pocket expenditure is on medicine, whereas in urban areas it is around 75%. The doctor's fees varies between 11 and 14%, and diagnostic tests account for 7 to 8% of out-of-pocket expenditure. Ladies and gentlemen, Pharma Leaders feel that Pharma Leaders 2016 Summit deliberations from industry stalwarts are aimed at shaping the future of definitive plans to address the healthcare issues, improve patient care, and deliver quality healthcare. We at Pharma Leaders are extremely excited to see that there are so many initiatives being taken to put patients first. Our goal, along with many others, is to provide an effective leadership platform to ensure that patients are the ultimate end areas of research. Our ongoing deliberations with healthcare leaders are aimed at bringing comprehensive healthcare reforms, where we work with patients, advocates, industry, regulatory, amongst many others, to share strategies to increase patient involvement and continuous engagement. Pharma Leaders understand that healthcare administration educators are at crossroads. The healthcare sector is rife with inefficiencies, erratic quality, unequal access, and sky-high costs, complex problems which call for innovative solutions. Indian healthcare institutions, especially the public sector organizations, are not educating the stakeholders to be innovative. Clearly, several barriers need to change, including shortages of public health or health administration faculty with appropriate managerial skills and adequate grounding in actual healthcare delivery, global markets, and holistic perspectives. In addition to these faculty-centric barriers, they noted difficulties in finding data on real-world organizations or material integrating healthcare and patients. Ladies and gentlemen, Pharma Leaders is aware that healthcare costs are rising faster than quality is improving. Significant waste in healthcare delivery persists, harming patients, providers, payers, and purchasers. Providers who do the right thing, improve quality, reduce waste, are penalized financially in a fee-for-service reimbursement environment. Healthcare cost and quality data are largely unavailable to purchasers and consumers. So, the market can't reward the good guys, and patients' health conditions must be addressed not just inside a clinic or hospital, but also where the root causes of our most common and costly health conditions are found, where people live, learn, work, and play. Ladies and gentlemen, clearly change is needed, but for healthcare to change, the education of its leaders must change. Innovative thinking really comes from the environment and culture of your organization or workplace. An open environment that appreciates diverse solutions to today's healthcare issues is something that fosters innovation is what Pharma Leaders believe. Satya Brahma, the charismatic chairman and editor-in-chief of Pharma Leaders, says if we want a more affordable and convenient healthcare system, we must demand it and embrace disruptive innovation. Disruptive innovation simply describes how industries transform to provide increasingly affordable and conveniently accessible products and services to consumers. Pharma Leaders feel that as healthcare consumers, we have a responsibility to not only demand better, more affordable care, but also to put our money where our mouths are. We do have a say in the treatment we need to be well. When we all start acting like citizens, we can turn things around. Healthcare system leaders need a vision of an integrated, enterprise-wide transformation. In addition, the current market pressures will not tolerate small increments of change. Significant organizational changes and dramatic improvement in performance in several key areas are necessary for survival. The transformation pie breaks down into several bite-sized pieces that need some discussion before digestion is possible. Pharma Leaders understand the pulse of the industry. Change in the medical marketplace is not incremental. It is transformational. It is a sea change. Those organizations that transform, realign and reinvent will be the winners, and those that attempt to modify traditional healthcare delivery will be the losers. Combined pressures have come to bear on the medical marketplace, including reimbursement compression, patient volume compression, information technology, and regulatory change. What follows is a very brief overview of the key drivers of change. That is followed by what organizations and practitioners will need to do to create system solutions to meet critical quality and reimbursement metrics and to improve performance, efficiency, quality, safety and satisfaction. Medical practitioners will have to be part of the solution. Remember, 86% of rural population and 82% of urban population were still not covered under any scheme public or private, to support health expenditure. In rural India, almost 80% of the out-of-pocket expenditure is on medicines, whereas it is around 60% in urban areas. It is therefore now or never. Let's do it now.
Celebrate healthcare innovations. Currently in its 9th successful year, the brand Pharma Leaders has always been at the forefront of bringing innovative ideas, initiatives, and definitive action plans. Pharma Leaders have lined up for you some of the best brains in the pharmaceutical and healthcare space to address the largest gathering of healthcare leaders, as more than 300 professionals of India and abroad will assemble here to witness the most prestigious and awaited healthcare event of the calendar year. You will be aware from the media report that Pharma Leaders Power Brand Awards has been honoring and recognizing outstanding contributions for more than a decade. Established by the illustrious healthcare communication media Pharma Leaders, the flagship healthcare brand of mainstream media network 7 Media Group, Pharma Leaders Healthcare Media. The objective of Pharma Leaders recognition is to honor the mind of the leader and be a part of the celebration. Pharma Leaders Power Brand Awards celebrate the accomplishment and spirit of the healthcare innovations by recognizing healthcare practice, governance, research, and entrepreneurship. Their greatest strengths have been their ability to spot innovations and value the spirit of pioneering efforts, their bold willingness to defy conventional norms and solve issues that people consider tough, their confidence in the future and refusal to be bound by the present. Their motto has been to endlessly, positively, and eagerly to tackle problems, to address that needs and unlock the potential of healthcare innovations and innovators. Ladies and gentlemen, Pharma Leaders do that and much more what other fails to do. Recognize and reward innovations, encourage experiments and pilots, and create a non-punitive environment. Let's kickstart this summit. The theme of Pharma Leaders 2016 annual edition is driven by patient engagement and education, and hence the title Patient First, as we scan the progress of India's road to uplift the patient care and safety in 70 long years. And the 9th annual Pharmaceutical Leadership and Pharma Leaders Businessship Awards therefore revolve around the patients, and yes, only patients at a time when big pharma companies are making huge profits and spend too little to patient care. So this award is brought to you by Breakfast News TV, India Affairs TV, Network 7 Research, Odisha Affairs TV, Pharma Leaders TV, Network 7 Media, ILC Power Brand, Pharma Leaders Academy, Pharma Leaders Power Brand, Pharma News PR Wire, in association with print partner Print and Pack, media partner Care World, trophy partner Creative Awards and Rewards, webcast partner Stream On, event partner Stagecraft, in aid of Little Hearts. Now let's get into the first segment for the evening. And to kickstart the segment, I would like to invite somebody who is known to everyone as KK. Currently Vice President Business Development India, Middle East and Africa, Glenmark Pharmaceuticals, KK has been with pharmaceutical industry for over 2.5 decades and has held leadership positions in companies like Alcan Laboratories, FDC, Vanbury Limited, and Wockhardt Limited. His success and achievements in this corporate spans across domestic and international markets. In early part of his career, KK was associated with huge success stories in Lederle and German remedies. KK is also renowned cricket commentator and sports anchor. He's none other than Mr. Krishnakumar Subramaniam. Can we please have Mr. Krishnakumar Subramaniam on stage with a huge round of applause?
Thank you, Shruti, and it's really a great pleasure to be in your midst again, and we're all together as one family, as I always say that. And just some time back, we were talking to a few colleagues from the industry, and we said almost everybody knows everybody, and that is the way the pharmaceutical and the healthcare industry resonates within itself and amongst the personnel in this industry. So, good evening and welcome to this Pharma Leaders Summit and Pharma Leaders Power Brands Awards later on this evening. Around a month back, I think it was probably little over 3 weeks back, when Satya Brahma called me up and said, can you just come over and moderate a very major summit that we are putting together in Network 7 Media Group. And, like somebody was telling me a few minutes back, they asked him, why do you want me to come? What's the theme and what do we do over there? And he responded, giving a couple of reasons. In addition to those reasons that were given to this industry colleague of ours, he also mentioned one or two couple of buzzwords, I must say, to me, which made me believe that, yes, let's be here and discuss and arrive at something even better than what we're doing and go back enriched and have some take-homes from today's summit. He mentioned, one of the themes that we're going to put together for this Pharma Leaders Summit is innovation. Innovation, quite obviously, for everybody in the pharmaceutical and healthcare space is a very, very, very big buzzword today. Not that it hasn't been earlier, but certainly today it assumes far more importance than probably a couple of decades back or so. Because the number of competitors in the market are huge, and everybody looks at what can I do different. So can I be absolutely innovative? Can I be creative? Or as an extension to that arm, can I have something different? Can I focus on differentiation? That being something that works in everybody's mind 24/7, I think that is a very interesting theme to take forward this summit. Yes, to begin with, the numbers are small, but I think it's a very knowledgeable audience that's over here and very informed audience that's over here that I'm sure will lead to a lot of take-homes for people who are here right now and people who will join us later on this afternoon and this evening. Yes, we also heard about Pharma Leaders Power Brands Awards, and I'm told it's in the 9th year that they are there in Pharma Leaders, and being the mainstream media of Network 7 Media Group. So quite commendable that for 9 continuous years, they've been putting together this magnificent summit, followed by what's been the Power Brand Awards, Pharma Leaders Power Brand Awards. And as we were walking in, we saw the pictures of some of the awardees of the yesteryears, and I think it's been some of the really big names who've been honored with these awards as well. To recognize and reward innovation and performance is what I was told. That is fundamentally the theme of today, post the summit deliberations, which focuses, as I said, on innovation. Innovation, and there's one more area that Satya Brahma told me. Second one is focus on patients. He said, somewhere down the road, I think all of us need to really focus more and more on patients and see what more can we do for patients, because that's the fundamental principle of the industry at large, getting to patients, serving patients. Patient engagement, advocacy, and patient literacy are key to healthcare innovations, as we often say. The overall goal of patient engagement is to drive consistent, sustainable behavioral changes in patients, even their family members, caregivers, and healthcare providers. And I believe it's not just to improve healthcare, but health as a whole. And the growing trend towards digitalization, technology and better communication, I think has also, in a way, or in many ways, fueled patient care and patient engagement much better. I'm sure there are a few people talking about it over here today. As I said, advances in technology as well as opportunities given to physicians to learn about them and also about newer drugs and the efficacy of their use in patients lends itself to considerable improvement in patient care. There's a wealth of information to be shared and exchanged here this afternoon and this evening. It's indeed commendable that we managed to get together some of the industry stalwarts and some of the luminaries from the industry. And as I said earlier, for sure, we'll take back home some very important add-ons, some significant value adds when we go back. And even if it ends up in a few new thinking areas, new thought processes, and of course, if it can, a paradigm change and looking at things differently, paradigm, new areas of thinking, I think it'll be worth the time and the few hours that all of us have spent here today. So without much ado, let's get moving with today's summit. And our first speaker for today is Mr. Mayank Gandhi, who's a social activist. He'll speak to us on healthcare in rural India, how technology can be leveraged for improving healthcare in rural India. Mr. Mayank Gandhi is a very well-known social worker. He's worked actively with many social and business organizations. Mr. Gandhi has contributed actively in formulating many useful laws like Right to Information for Maharashtra, law relating to transfer of government employees, law relating to Nagar Raj Bill. Mayank Gandhi is associated with the Jan Lokpal movement right from the very inception and has contributed a lot in strengthening the movement in Maharashtra. Mayank was the face of the anti-India or India Against Corruption movement in Maharashtra and spearheaded the campaign to challenge the establishment towards the same. Currently, Mayank spends a lot of his time in doing a lot of things that we can do, and that is, Mayank spends a lot of his time presently in villages working for poor, weak, and needy. Ladies and gentlemen, bring your hands together to welcome Mr. Mayank Gandhi, our first speaker for the day. But before Mr. Mayank Gandhi comes up, may I request Shruti to come forward and maybe we'll hear a few words from the man who's put this show together, Satya Brahma, after which we'll probably bring up Mr. Mayank Gandhi for his talk. So Shruti, if you can probably invite Satya for a few words.
Yeah. Thank you so much, KK, for your kind words. You really enlightened us. And yes, guys, you will hear Mayank Gandhi in a short while. But before that, let's get the man who has bring us, all of us together under one roof for Pharma Leaders Award. He is the founder, chairman, and editorial head of illustrious Network 7 Media Group, having its wide portfolio in mainstream media in the form of current affairs, news magazines, specialized and much widely acclaimed global meeting events, and healthcare communications and digital media. Under the banner Network 7 Media Group, Satya founded Pharma Leaders. Well, I can go on and on, but we have AV for you. So can we please have the AV to introduce Mr. Satya Brahma?
necessity spawns innovation. Despite the odds and confusion, we must not lose hopes. Let's think global. Change and innovations are twin fatal components to foster healthcare reforms. It is time for all-round disruptive innovations. If we want a more affordable and convenient healthcare system, we must demand and embrace disruptive innovation. Unless we take risks, we can't possibly be the change agent. Are you ready for the game? Be the change agent and embrace the new world order. Meet Satya Brahma, the dynamic and visionary healthcare leader. Leading the campaign to a new level is the chairman and editor-in-chief of Pharma Leaders, the flagship healthcare brand of Network 7 Media Group. Satya says, the world won't change unless you become the change agent. We must voice our opinion, punish the culprits, take decisive action, and be bold and sincere. Healthcare policy is meant to empower patients, and hence the reforms must be patient-centric, with focus on compassion, quality, integrity, and respect. In India, the healthcare system is struggling with rising costs and uneven quality. So, it is very important to achieve the best patient care at the lowest cost. With the help of technology, quality service, and unparalleled healthcare experience. Both the World Health Organization and India's Rural Health Mission consider the use of technology imperative to bringing better health care to India's most vulnerable people. Pharma Leaders' vision is to emerge as a leader in healthcare communications to make an impact in $125 billion healthcare industry and building a technology-driven healthcare delivery business that makes a difference in the health of the people living in rural areas.
Gentlemen, please put your hands together for Satya Brahma.
Thank you, Shruti, for your kind words and a warm welcome to all of you for this wonderful afternoon, which I've worked for the last 3 to 4 months, trying to find out what could be the X factor in the Indian pharma and healthcare industry. People often ask me that why you are so aggressive and do not have a vision that speak positiveness and bring that kind of consensus. Let me start by saying you, the year 2017 is going to be much more important because of one single person who has become the President of United States, Donald Trump. For the first time in the history of the world, one person is going to control the entire world who probably doesn't know what is next step going to be. Why I'm talking about Donald Trump in this pharma conference actually? This has a tremendous impact on the pharma industry. Donald Trump is the one businessman, not a politician, who thinks the world in a different way. People thought that Hillary Clinton is going to sweep and she's going to be the President of the United States. It didn't happen. There was a strong undercurrent going on and Trump became the president. And look at his cabinet. Look at the kind of associates he's got. These are the people from the business world. And to me, if you ask me, he has done the right thing actually. He wants to change the system. But at the same time, we stand at the threshold of an unpredictable era where you cannot expect what the healthcare policy is going to be there in United States, which will have subsequent impact on India. Having said this, let me tell you, the current Prime Minister of India, Mr. Narendra Modi, who came to power in 2014 election with a sweeping mandate from the people, has risen above and proved that he could be the change agent in the coming days to come. In the initial 2.5 years, you saw Modi traveling around the world. There were people who were talking, why is going abroad? Why not spending time in India? Why not keeping the house in order? But do you know what he did actually? He did what others couldn't understand. He did what Mayawati didn't understand. He did what Rahul didn't understand. He did the entire India understood, and that is, he built the image of India to the world. And to me, that is the turning point of India's emergence as a global power. And if you ask me straight, he is the man to be looked very seriously. The relationship between Donald Trump and Narendra Modi is very deep. In the open world, Donald Trump has spoken and is quoted having saying that the present Prime Minister of India, Narendra Modi, I'm a big fan of him. People talk about Hindutva, people talk about so many things, but we know how he has performed. Suddenly you found the power of 10 rupees, 100 rupees notes. Look at the demonetization thing, what he did. This has a great impact on the Indian economy and to the healthcare industry as well. Despite all those innovations that is going around the country, sometimes I get disturbed. Sometimes I get puzzled that why in India, when we have so much policy in place, our present health minister, Sri Jagat Prasad Nadda, such a fantastic person, and I'm privileged to have the advisor to the health minister, Sri Rajendra Gupta ji is here. He has been taking lot of initiative. But the problem to me, what has happened is, and I know correctly what has happened actually, we have a baggage of around 70 years. In those all 70 years, we kept on signing memorandum of association. We kept on doing those things which we thought could change the world. The architect of Indian economy, Dr. Manmohan Singh, great visionary, of course, is a big statesman. He is the one who changed the landscape of India. Thought that, he could give free medicines to entire populations. Is it going to be possible? That could have been a game changer actually. But he should have thought that the people around him, the system that he has inherited, the remote control that he has, the kind of infrastructure that he has is not conducive enough to make that thing possible. And above all, how you know that you give free medicines, which medicine from which pharmaceutical company or to any company's charge are going to make a difference? Narendra Modi doesn't believe in that. He doesn't make tall promises on healthcare. His focus is clearly right. And I'm not praising Prime Minister Modi because I'm saying what my heart says. In previous occasions, you have seen that I was one of the strongest critics of Narendra Modi. But I've seen the kind of change in him. He's telling, as long as India's populations, as long as the people who are there in the rural areas do not get basic healthcare access, India is not going to change. And for that, he has taken a single step, that is a comprehensive healthcare reforms. I want to see when the health minister gives the report to the Prime Minister's office, and I know it is working very fast, he has already developed it. Mr. Gupta is instrumental in bringing a lot of papers that contains the reforms process, and he has been chairing a lot of commissions and committees. He will be giving his own viewpoint today. So that would be very critical if you bring out that thing and comprehensive healthcare reforms are carried out where the out of expenses when there is no universal healthcare insurance, people pay out of the pocket. That is actually pinching. We don't have doctors in the rural areas. That again actually bothers me. No doctor wants to go to the rural areas. Pharma companies are doing good. I completely compliment them. But the problem is, how will they distribute the medicines? How will they do the logistic activities if the PSCs, the infrastructure, and the basic amenities are not conducive enough there actually? The pharmacy. This is where the present health minister is working tirelessly now to bring that system in place. This will lead to a universal healthcare insurance. And those who are all of us here now, we are going to see something which will completely change. And I'm quite optimistic when I say this, because I know things are going in the right direction. But we must believe, we should not lose hopes, and we should not talk too much. We should work on the ground, see what is happening. Pharma Leaders, my own organization, which I floated around 13 to 14 years back, I never looked at these things. I only brought out those things which reveal the true picture of India. I have visited so many places. I have seen so many healthcare centers. I have interacted with so many doctors. I have interviewed more than 2,000 CEOs of the country. And I know India has got tremendous talents. We have with us Glaxo Managing Director, Mr. Annaswamy. There is a fantastic person. We have some of the greatest persons here now. They are the people who are trying to make a difference. These are the people who will actually save the change of India. These are the people who actually will be the torchbearer of a new India that is going to emerge. But is India ready for it? When I tell each India ready for it, this means when OPPI, when IDMA, when IPA, when BDMA, when Pharmaceutical, these people come together and have a single voice. I want to see a clear consensus between Indian companies and MNCs actually. I am not willing to buy a logic that they're having a different perceptions. I am of the opinion that in fact they're one actually. So sometimes later I'm thinking of bringing these bodies together and brainstorm these issues. Another thing which is very important for us to deliberate here is about the patient care, patient safety. When I thought about the theme of this 9th Annual Pharmaceutical Leadership Summit, I thought, what could be the topic? Then I realized that the ultimate beneficiary are the patients. These are the people who are the real beneficiaries. The pharma companies, the doctors, the pharmacies, the diagnostic companies, the medicines, whatever you do, ultimately are the real beneficiaries are the patients. But who think about them? Yes, we produce medicines. India has the largest manufacturing capabilities. Our manufacturing capabilities are much more stringent, much more bigger than what US has. What US FDA is doing is completely wrong. They don't even look at what is there actually. And I can guarantee you, and I can tell you that if you go to US and other European countries, their manufacturing capabilities will not be that capable what India has. So there is something which is happening, and we must try to find out what is that thing is happening. One thing is happening for clear, is that there is a strong vibration. There is a strong message that is going out that we need to change. Not the way that we changed in the past, because we did nothing in the last 70 years. It is time for us to change. It is time for us to look at patients as the ultimate beneficiaries. Can they go to buy a pharmacy stores, buy medicines? Do they have money? They don't have. As you saw in one of the videos that some of the areas where there is remote areas, no doctors, no medical facilities, they often don't know what the disease is all about. And I'm told the Ministry of Health is working heavily on these areas to diagnose these things, why it is happening, to bring an awareness. So there are three things which is going to make a big impact in the days to come. Innovation, access to healthcare, and affordability. If these three factors are met with challenges, then no one can beat us. Like defense, healthcare is going to be the most important sector in India, and that would change the very notion of India and public at large. And when you go abroad, people would not tell us that this is what India sees you actually. Finally, I would like to tell you that in the year 2017, when the pharma industry is doing so well, when there are so many hospitals have come up, when there are so many facilities who have in hand, they are going to actually escalate the process and going to bring much more innovation actually. We might see number of beds increasing. We also might see so many doctors coming up. And if I'm given a correct information, there are at least going to be around 200 to 250 joint ventures, acquisitions are going to happen, both in the pharma industry as well as in the hospital sector. And the process has just started. So whatever the Indian companies are going to see will be going for public ultimately. They will be responsible for the public at large. So they will look at the public at large, they will look at the patients, and they will see what the bright picture is all about. This is the real India that will happen in the new millennium, and I'm quite hopeful that this will change our perceptions and we will be a healthier India. With these notes, I think I've spoken too much. Thank you very much for giving me time to speak.